Hello, and welcome to OptiMed Health Plans. Today's webinar, we are going to be focusing on our new short-term medical offerings. If you'd like some more information about our short-term medical plans, you can feel free to email your group health sales representative here at OptiMed. You should have the invitation to the webinar. Their contact information should be there. If not, I'll also give the general contact information for here at OptiMed at the end of the presentation. Additionally, if you would like some information on our other products, our most popular product is our GAP program by far. That is where we insure deductible and co-insurance on major medical plans that you write. It's on a group chassis, not an individual chassis like the short-term medical program. We need a minimum of 5 enrolled. So if you're working in that group health marketplace and you're facing difficult renewal situations, feel free to reach out to us about GAP because that can help solve that problem for you. We do limited benefit programs. We have MEC, minimum essential coverage programs. We do self-funded major med for larger groups. We have dental, we have vision. So if you're interested in any of those products as well, feel free to reach out again to your group sales rep here at OptiMed after the phone call, and they can get you information on short-term medical and any other products that we offer. So with that said, let's go on and get into short-term medical. So what we're going to talk about is, a brief overview and the why, why you would want to sell a short-term medical program. In addition, we're going to go into plan designs, eligibility, enrollment, and essentially post-sale. So let's first start off with a brief product overview. So when we're talking about short-term medical, we have 2 different types of short-term medical programs that you can sell. We have standard issue and we have guaranteed issue. So guaranteed issue, guaranteed issue. Standard issue essentially means health questions. And we'll get into a sampling of some of those health questions later on in the presentation. But that's really what you want to keep in mind is that when you're talking about the 2 different types of short-term medical plans that we offer, there's standard health questions and guaranteed issue. Policy terms are available from 30 days to 3 months right now. We're aware, and I'm sure a lot of people that are on this call are aware of the recent legislation that changed short-term medical plans so that you could do longer terms. We anticipate being able to offer longer terms in the next several months. I would say that's probably going to be rolled out sometime in October, November is the anticipated time span for that. When and if we can offer longer terms, we'll definitely, send a blast out to all of our brokers, and we'll definitely let you know. But for right now, it's going to be 30 days to 3 months. We have pretty broad state availability. I think the product's available in approximately 40 states. If you have questions about whether or not the product is available in your state, it's easier to go through some of the ones that it's not. So the big states that it's not available in is like California, Massachusetts, Minnesota, New Jersey, New York, the state of Montana, the state of Washington. I don't know if I mentioned that one, as well as Alaska and Hawaii we don't do. But every other state, we should have some, or there's maybe a couple other ones, like I think Rhode Island. But if you want or interested in, they'll have some state availability when we're going through the presentation. If you have a particular question about your state, there are differences and little nuances depending on which state you reside in, and that's the state that the actual member or individual resides in. You want to and talk to your OptiMed sales rep about some of those little nuances. So if you work in Pennsylvania, where I'm located, if I had members that I was going to try to enroll or sell to in the state of Pennsylvania, I would talk to my OptiMed rep about, are there any differences in Pennsylvania? Is there standard issue? Is there guaranteed issue available? Some of the things we'll go over in the presentation about the life association. Selling it with a consecutive, you can do 4 consecutive terms, and we'll get into that. So some states you can do that type of stuff, some of them you cannot. So again, the big thing I want to leave you with, I'm going to say this a lot during the presentation, is contact your OptiMed sales rep to get information or additional information about the product. They can get you brochures, how to get contracted, stuff like that. What we want to do is try to make this an easy enrollment process, and we'll kind of get into how the application works a little bit later in the presentation. But as I said before about the Life Association, in some states and in most states that we're selling the short-term medical plans in, coverage is only going to be available through the Life Association membership, and I'll get into what that means. But just be aware that in some states you have to be part of the Life Association in order to get access to the short-term medical program. So why would you want or why would you sell a short-term medical plan? You're really not looking as a replacement. Like, you're not going to go into a group and say, I want to replace your major medical program with a short-term medical program. What it's designed to do is try to help people that have like sort of missed, like for example, the first one here. They missed their open enrollment and they don't have a qualifying life event. So I work for XYZ company. I missed the open enrollment period. I really need health insurance right now, but I don't have a qualifying event that will allow me to enroll in the group major medical program. Well, you could take a short-term medical program and give that to that person in that employer group temporarily until their next open enrollment period is going to begin, and then they can go ahead and enroll onto the group major medical program. So that's just one little sell point of where you're going to find short-term medical has a fit in the marketplace. You're also going to have people that are maybe retired right now and they're not working, or they're working, but they're working for a company that doesn't offer them benefits and they're waiting for their Medicare eligibility to kick in. So short-term medical could be a solution for that individual because they can go ahead and enroll in the short-term medical program and get the health insurance coverage that they're looking for while they're trying to get or wait for Medicare eligibility. You also have international students who may need insurance while they're here, so they're not going to be here for a full year. So why would you enroll them in a plan that has a one-year policy? If they're only going to be here for a semester, they're going to be here for 3 months, 6 months, you could put them into a short-term medical program that would help them out while they're here in the United States. You also have people who are going to be waiting for benefits to begin in a new job. So for example, they get hired at XYZ company. XYZ company has a 90-day waiting period, but I want insurance right now. So how do how can you solve that problem? Because the group's not going to change their waiting period just to hire this one individual. And who knows if they even can just call Blue Cross and Blue Shield or whoever their major medical company is and say, hey, I want to change my waiting period from 90 days to the first of the month following hire date. Probably can't do that until renewal anyway. So how do you help that individual? Well, short-term medical, you could do a 3-month plan, put them on a short-term medical program, and then when their 90 days is over, their waiting period's over, they can enroll in the group major medical program. You're also going to find individuals who go onto healthcare.gov but make too much money to qualify for a subsidy, but they're not making millions. They just probably make $50,000, $60,000 a year, so they don't qualify for subsidized coverage, and they don't qualify for Medicaid because they make too much money. So those individuals might go on to healthcare.gov and see a premium of $200, $300 based off of their age with a $5,000, $6,000, $7,000 deductible, and they just feel that it's unaffordable to them, to have to pay 5, 10% of their income out in the form of premium for a major medical program. So short-term medical can be a solution to that individual, as it should be more affordable than a full-blown comprehensive major medical program, especially for somebody that's not going to qualify for a subsidy on the exchange. So those individuals that can't afford health insurance on the exchange but would like to get health insurance, this is a very good option for those people as well. Oh, and there's a little note on the side there. This is not minimum essential coverage, so just so you know, for those who are on the call, it's not considered minimum essential coverage under the law. Short-term medical programs are accepted benefits, essentially limited benefit programs. So plan design options, standard issue. So again, that means health questions. It's available in those states below on your screen, but there's also other standard issue policies that are available in other states. and we'll get into that in the next slide. But right now, these are the plan design options that are available in those states below for standard issue. So as you can see, there's a few different deductible options that goes from about $1,000 to $25,000. You have co-insurance that goes from 50/50 to 80/20 to 100%. You have out-of-pocket maximums from $3,500 up to $27,000. And then you have a coverage period maximum of $250 to $1 million. So let's just talk about the coverage period maximum for a sec. When we're talking about coverage period maximums, we're talking about the maximum benefit the plan would pay during the coverage period. So for example, if you have a 30-day policy and your coverage period maximum is $250,000, you have $250,000. That is the max the plan will pay during that 30-day coverage period. If you elect a 3-month policy, then you have $250,000 of maximum benefit that the plan would pay during the 3-month period. It's based off of the period that you elect. It's not a yearly or annual maximum. It's a coverage period maximum. So because you have a lot of different plan designs and a lot of different plan options, I mean, you even have something for somebody who's just looking for something catastrophic. You know, I want $25,000 deductible with a $27,000 max out of pocket with $1 million plan or coverage period maximum. So yeah, I'm just looking to cover something that would be catastrophic. I have, you know, I'm fairly healthy. If I get sick, I can go to something like the Minute Clinic and get Tamiflu and get it prescribed and just pay for it out of pocket. I'm more worried about catastrophic losses and something really severe happened to me. I don't want to wind up in bankruptcy. So you could go with something like a $25,000 deductible for that person, make them very happy, give them a coverage period maximum of $1 million, and essentially cover that member or that individual very well catastrophically. Now, when we're talking about plan design options, again, those states below are again standard issue, but the difference is, you'll notice, the other plan had a $1,000 deductible with 50/50 co-insurance with a max out of pocket of $3,500 and a coverage period maximum of $250. But if you're in Pennsylvania, it's not a $3,500 max out of pocket, it's $6,000. So the out of pocket maximums are different in certain states for standard issue, and those states are below. But that's really the only real difference, is that you have still similar deductibles, $1,000, $25,000, but your out-of-pocket maximums increase, but your coverage period maximums don't decrease, which is a good thing. But you do have slightly more out-of-pocket expense if you're in, or out-of-pocket exposure if you're in certain states. Now, when we talk about guarantee issue, there's only 2 options. You got a $3,500 deductible with 80/20 co-insurance with a max out of pocket of $10,000 and a coverage period maximum of $100,000. Or B, you got a $5,000 deductible with 90/10 co-insurance with a max out of pocket of $10,000 and a coverage period maximum of $100,000. So those are your only 2 options when we're talking about guarantee issue. Now, it says below that guarantee issue plans are subject to pre-existing limitation conditions. So you want to make sure you're aware, and that the individual that's applying for the coverage is aware, that if they're doing guaranteed issue, that there is a pre-existing limitation condition on that. Now, as far as Aetna, or as far as network is concerned, Aetna is your network. And it's the Aetna Open Choice PPO network. So if you wanted to do a provider search, and I would recommend doing a provider search, because again, this is individual. If I had an individual residing in XYZ state, I would do a provider search with using their zip code, do like a 5-mile radius around them to see how many providers they have in their zip code. If they have none, I mean, in certain rural areas, yeah, I mean, going out 10 to 25 miles is not unreasonable. But if you don't have any providers in a 25-mile radius around where the individual resides, you know, I don't know if this was maybe the best plan for that individual. They'd have to travel pretty far to try to see a doctor. But Aetna is a national network, and they have over 664,000 medical providers and 5,600 hospitals. So finding a provider in a certain area shouldn't be too difficult. And that's why we're using the Aetna network, is it is a national network, has good discounts, and essentially has access for members in most areas. But again, to be certain, I would do a zip code lookup on Aetna's website to see if there's actual coverage as far as providers, if I was selling it to an individual in a certain state. The other thing you want to note again is it's the Aetna Open Choice PPO network. You want to make sure you elect or choose that when you do it. Now, plan details, benefits. So it provides doctor office visit benefits, but they are subjected to deductible and coinsurance. It has urgent care benefits. There is an unlimited amount of urgent care visits that you can use. The insured is going to pay a $50 access fee per visit. The plan deductible is waived, which is great, but the visit charges themselves are subjected to co-insurance. Now, conversely, if you go to an emergency room, again, you got unlimited visits, but the insured is going to pay a $250 access fee unless they're admitted. And the visit charges are subjected to deductible and coinsurance. So you might want to let the individuals know using an urgent care facility can save them, because not only is the access fee 5 times less, but additionally, emergency room is going to be subjected to deductible where urgent care is not. So if you're enrolling an individual or applying for coverage for an individual, I would let them know to try to, if they can, go to urgent care if it's possible, rather than emergency room. It'll save them a lot of out-of-pocket expense. There's also benefits for ambulance. It's, again, unlimited on the amount of ambulance trips, and the plan pays $250 per trip. That's not a copay. That is the benefit that the plan actually pays. So it pays $250 per trip on an unlimited amount of trips. And you'll see there's a note at the bottom that if you're in the state of Colorado, Florida, Ohio, Maryland, New Mexico, Oregon, Utah, the plan pays one $50 first dollar benefit for one doctor office visit. Then all your subsequent visits are applied to deductible or coinsurance. So essentially, if you reside in one of those states, or the individual resides in one of those states, they'll get a $50 benefit for their first office visit, and then everything after that's going to be subjected to deductible. Or I should say So we talked about the life association. So with the life association, in certain states, you have to become a member of the life association in order to apply to or get coverage on the short-term medical program. With the life association, you get, it's not insurance, right? They're non-insured benefits, but you get things like telemedicine, where you can connect to a physician via phone or via, video. There's unlimited amount of consultations that you get. And so that's a phenomenal feature, especially when you have doctor office visits being applied to deductible and coinsurance on this plan. So if it's something simple like you got the flu, you can just simply call telemedicine, get a consultation over the phone, and they can prescribe you like Tamiflu, and you can go pick it up at your pharmacy, and there's where your RX discounts will come into play, because through the Life Association, you'll get prescription drug discounts when you go to pick up that prescription drug. So if it's a non-emergency situation, or it's not like threatening, or if it's something that, the employee feels that they can just get a consultation over the phone, if it's something simple like poison ivy or the flu, I have a cold, what can you prescribe me for it? Using telemedicine will save them money, because if they're going to providers, normally they're going to pay for that through deductible and coinsurance, so they're going to pay for the entire visit. So it's better to have a free consultation via telemed than pay for that out of pocket if it's something simple. There's also things like discounts on lab. There's also other benefits like fitness programs and auto discounts, identity theft, discounts on things like travel and dining. So you get a nice little feature with the Life Association. And again, there's certain states where you have to become a member of the Life Association in order to get the short-term medical, and there's some states that it's not available at all. there's a map we'll go into next that kind of shows you where they're located. So most, again, are life association states. Some are not. If you have a question about it, again, feel free to contact your sales rep here at OptiMed. They can get you more information if the state that you're selling or the individual resides in has life membership associations. And just to let you know, I mean, it's not like you have to go to a different website or you have to go to someplace else, become a member first, then go on. I mean, it's all done when you're applying, that you're applying for not only the short-term medical plan, but you're applying for the life association as well. Eligibility, so age, 60 days to 64 years, and that is correct, 60 days. So children up to the age of 26 can remain on their parents' plan, but you can actually do a child-only application. So you could have a child that's 4 years old as a child-only applicant. If you have multiple, they use the oldest as the primary. But you could do children-only applications from 60 days to 17 years of age, which is a nice little feature of this. Now we talked about standard issue, and we talked about health questions. So here are some of the questions that you can expect when you're doing a standard issue policy. It's going to ask questions about pregnancy, about weight, mental illness, HIV. It's also going to ask if you've been, within the last 5 years, been diagnosed or treated or experienced symptoms of things like cancer, stroke, diabetes, arthritis, and it's a 5-year look back is what they're asking for. So when you're going to apply for standard issue policies, just understand that those questions will be the questions that the employee is going to have to attest to and either say yes or no that I have been diagnosed, or I have been treated, or I've had symptoms of, or taken a medication for, COPD. They're going to have to check yes to that when they're applying. The good news is that if one or more, they do answer yes to one or more of those, we do have guaranteed issue, as we spoke about. Guaranteed issue plans are available in the states listed in front of you now. And again, if you have questions on state availability, just shoot a quick email to your sales rep here. They can get you brochures, they can get you information on how to get contracted as well. And just remember that short-term medical guaranteed issue plans do have a pre-existing limitation condition. So you just want to make sure that the individual is aware of that. So we talked about some of the exclusions and limitations. I mean, exclusions and limitations are things like maternity, expenses that are incurred outside the United States, acts of war, mental illness. Obviously, this is not a complete list of the limitations and exclusions. These are just the bigger ones. If you want a complete list of the exclusions, limitations, email your sales rep here. They can get you the brochure for the program, which has all the policy limitations and exclusions on there. So you can take a look at the full list. But these are the big ones that you just want to be made aware of. So I touched on this briefly earlier, but the great part of this program is that you can actually sell 4 short-term medical plans with 1 application, meaning 4 consecutive 3-month plans. So essentially extending coverage up to 1 year. So what's going to happen is a customer is going to apply for 1 standard issue short-term medical plan, and then they're guaranteed eligibility for the next 3 consecutive plans. The reason why this is great is that they only have to pay 1 initial application fee, not 4. So it saves them money. But more importantly, the pre-existing condition look-back period is based off the policy's first effective date. So if you're going on to a short-term medical plan as of 9/1/2018 is what they're going back. So when you go to your second policy period in December, they're not looking from December back. They're looking from September back as far as the pre-existing limitation condition is concerned. So that is very important if somebody does want extended coverage, to sell them consecutive plans, because it'll save them money with the application fee, and it's going to save them money on, or it's going to save them potential issues with pre-existing condition limitations, because it's going to be based off the policy's first plan or first period. And again, we talked about, federal regulations right now have changed, but as of right now, this is the most that we can do. Is 3 months, but then you can write 4 consecutive plan periods. So when you do sell 4 short-term medical plans, right, with 1 application, just make sure you note the following: the deductible, the max out-of-pocket, and the coverage period maximum reset with each policy. So if you, again, took it out in September 1st, on December 1st, that deductible, that coinsurance resets. Those accumulators reset on each plan policy coverage period. But the good thing is, so does the coverage period maximum. So it's not like you have a $250,000 maximum, you use $50,000 of it in the first 3 months, then next time you go to your next plan, you still only have $200,000. The benefit resets, and now your plan maximum becomes $250,000 again. So yes, the accumulators reset, but so do the benefits. The plan design's got to be the same for each policy. So you can't have a $1,000 deductible for the first 3 months and then go to a $25,000 deductible in the second 3 months. It's got to be consistent throughout. And in addition to that, you have to have consistency with the members. The members must be the same on each policy throughout that 4 consecutive periods. And what's going to happen is the customers have to complete and attest to the health questions and pay the monthly premium payments on time, in order to remain eligible for the plans. Again, as I said earlier, certain states have certain different quirks, nuances, rules, regulations. So these aren't available in those states, the 4 plan options. So you want to make note of that. Some you can do 2, but you can't do 4. And again, if you have questions, you should really reach out to your sales rep here at OptiMed. They can walk you through any kind of weird things that are involved in your state and get you brochures. Now, when you sell a short-term medical program, there's additional things that you can add to and enroll in at the time of application. So you can take out term life, you can do accident, critical illness, cancer, hospital expense protection, dental PPO or dental indemnity insurance. So these are just extra added features, riders, add-ons to the short-term medical program, but it can help make that short-term medical program even better than what it is now. By adding a cancer policy, by adding critical illness to it, by adding a dental program to it, you're creating a better benefit program for that individual who's applying for coverage. So those are available. They're not going to be available in every state. When you go to apply, it'll give you those options if you are, once you elect the short-term medical plan that you want, it's going to give you options to add these if they are available. If they're not available in that state, you're not going to see these options to add. So enrollment. Your coverage can start as early as the next day, which is a great thing as well. And again, the coverage terms can be 30 days, but no more than 3 months. So what's going to happen is at the time of the application, there'll be an initial payment, an application fee. If they do recurring, meaning they're going to do 4 consecutive plan periods, they can set it up to do monthly, where at 5 days before their next period's coverage is going to start, they'll pull that cover or that month's or that period coverage premium 5 days before it starts. Or if they're only doing one, let's say 30-day plan or 1 3-month plan, it's just going to be a single payment. And they'll pay for the premium for that 30-day period all up front. or if it's 3 months, they're still going to pay for it all up front. They can pay via EFT, Visa, Master, or Discover. And again, I went over this, but in certain states, again, the rewrite policies are different. So for example, looking at the screen, Kansas and North Dakota is limited to 1 rewrite. There's certain states that have, again, certain little nuances, rules and regulations that you have to be aware of. So if you're in Kansas, I would, and you want to write policies in Kansas, talk to your OptiMed sales rep so that they, you can go over, are there any, nuances that I need to know about selling short-term medical in Kansas? Can I do 4 consecutive plans? No, you're limited to 1 rewrite. So a recap, Aetna is the network, and it's the Aetna Open Choice PPO network. In certain states, you have access to the Life Association membership benefits. These are non-insured benefits for things like telemedicine, discounts on anything from auto insurance to dining and travel. You have options that can fit, customers' needs and budgets. We spoke about, why would you want a short-term medical plan? Because I, quite frankly, can't afford a full-blown comprehensive major medical program, but I want some coverage for, or I want medical insurance. So what's an affordable plan that I can, get that, meets my budget and my needs? And that's what really short-term medical is all about. There's a $50 access fee for urgent care visits. There's an unlimited amount of visits, but the visit charges are subjected to co-insurance. But the good news is it's not subjected to deductible. You can be as young as 60 days old and enroll, so you can do child-only policies. And guaranteed issue is available in certain states. So if they answer yes to standard issue questions, you have guaranteed issue to fall back on in certain states. That wraps it up. So if you're interested in selling the short-term medical plan with OptiMed, contact your group sales representative here. They'll get you out brochures. They'll get you out contracting information. It's basically a link that you'll get via the sales rep. You'll go onto that link. You'll fill out your contracting paperwork, and then essentially you'll get a link so that you can go on and start quoting individuals for short-term medical once you're approved and your appointment's approved. But in the meantime, we can get you things like brochures out so you can take a look at it. Have any questions on it, you can feel free to contact your sales representative here at OptiMed to ask questions once you take a look at the brochure. Your contact information for your group sales representative should be on, again, the email, the invitation that you got. If you don't have that, the phone number for OptiMed is 800-482-8770. And when you call in, you just want to hit the prompt for sales. I think it's prompt 4 for sales. You can also email sales@optimedhealth.com and sales@optimedhealth.com if you don't have the invitation from the webinar saved, or you don't know who your group sales rep is here. I want to thank everybody for attending the webinar today and look forward to working with you in the future. Thank you.